Hi everyone, today is the 23rd of April 2025 and I'm here at Newham General Hospital to see the Urology department. So yeah, let's go in and see how they can help us. As you know, I've waited months for this appointment, so let's see how they can assist us today. Yeah, that's it.
There was a lady yesterday that
Okay, that's
looking
fine, yeah.
for
You just need to.
and then she was saying,
You just need to do a urine sample, and then when you're done with it, just hold on to it, and then the nurse will take it. Yeah.
Need to do it right now.
Yeah, right now.
see him at
So
all.
not seeing the doctor first.
Sorry?
Not seeing the doctor first.
No, because they're gonna do that, and then they're gonna collect it and test it.
Are you gonna put the label?
They're gonna put the label.
Okay.
And then no one told me about him, so I don't even know you.
May I confirm your full name and date of birth, please?
That's Shahjul Rahman, 1701-99.
Okay. Any allergies?
I know I know this.
I'll take this one. Is it this one?
That's it.
Sit on the right side, please, and then we'll call you. Hello, sir. You can sit.
Hello. Hi, there.
So, what music do you listen to?
All sorts actually.
Huh?
Urdu? No, I said all sorts.
All
of music,
sorts
yeah.
of music. Okay. So you're Sharjeel
Rahman, that's it.
Rahman. Where are you from originally?
From Pakistan,
Where?
Lahore.
Lahoris don't keep time, do they?
We got the system of time itself.
Huh?
We do keep time. We do keep time, yeah.
You do keep time?
Yeah, we got the system of time itself.
What do you do work-wise?
Previously, I was an IT engineer, but currently, because of my conditions, I cannot work at the moment.
And what is your condition?
I've got a lot of pain internally in my organs, especially both my kidneys and my liver, and the surrounding organs. And I've been chasing up the GP and everyone for a very long time, and yeah,
For a very long time.
Yeah, I've been doing a lot of scans privately, from blood tests, ultrasounds, MRI, CT.
And what do they tell you in the
And,
private sector? Because the reports that we get, there's nothing much in the private sector that they've said to you that they said everything looks
They're
quite
incorrect.
neat.
They're incorrect because even the reports have not been able to match each other, and my scans have been fabricated to cover up my true conditions. Also, when you have a look at the scans, they have mentioned there's a hemorrhage only in the right kidney, but that hemorrhage was there in one of my scans. In the ultrasound, it did not appear, and in the second scan, it has reappeared.
So you still insisted on going into the private sector for all these scans because we don't see
I've had to because this is my, to survive, I had to do all these scans, and I've been through hell chasing the GPs and going back and forth. Again, like I said, I've been in a lot of pain internally, in especially the organs, and something has.
So have you ever seen blood in your urine?
I have, and I've mentioned it. I've shown the image to the GP also. I've kept a record of it, and yeah, there's so many things that
And when did you last see? Because today there is none. At least we know this.
I've waited months for this appointment because I was told it's going to take 3 months for some reason.
It doesn't take that long. You're here. They sent us a referral last 3 days.
I've waited months. So I got a MRI scan done privately for the abdomen, and from there they found the hemorrhage has reappeared somehow, and then they have sent me. So now they have marked as urgent and told me to come here.
Okay.
Before I was told wait 3 months, just take 3 paracetamols for some reason, which I find ridiculous. The amount of pain that I've been through, unable to work, unable to walk properly like a normal human, like I used
So
to.
have you seen any orthopedic person because you are unable to walk? It seems?
I haven't. I've done everything from my end to keep a record of all my.
No, but did you
medical-
talk to your GP? So, in terms of what you're saying, what is your main concern?
So the
Say,
GP.
if you didn't know about your MRI scan showing cysts or hemorrhage,
Mhm.
how did it all start? Is what I intend to know.
So I was poisoned quite a while ago, and I've
Poisoned.
poisoned, and internally it has destroyed my organs.
How
which,
was it that you were poisoned?
That's what I'm not sure. I've reported this to the police. I've done everything from my end, and like I said, I've been going back and forth with the
No, but when
GP,
we
the
say-
hospital, getting the scans done privately, and like I said, it's a massive cover up of making me seem that I am lying or I've somehow done this myself.
You're here in a hospital.
Mm-hmm.
You're in a cancer clinic today.
Mhm.
You know that?
No, I don't know. I don't know. They just sent me to urology.
No, but who sent you here? Somebody
GP.
would have referred you.
GP.
The GP's referral is here with us.
After months, after.
Well, that's I can't answer for everybody, Sharjeel. But what I'm saying is that the history that we get from your GP is not really very, very descriptive of the fact that this is a cancer clinic for people who bleed in urine
Mhm.
and have bladder cancers. And you fit neither bill. You don't fit the bill
So
for
I've
this
had-
clinic, but therefore we need to be clear as to, I think, what you are saying. Yes, your GP is not explained to you. You've been to other doctors. We can see the reports. There's a 28-page referral, and you're not even 28 years old.
That's true. Yeah.
So you have a bigger referral than most.
Like I said,
and
I've
we've been
been-
through it, but it didn't still give us the impression of what's the basic problem. So what I wanted to know, how did it all start? And you said you got poisoned.
Mm-hmm.
Who could poison you?
That's something I don't know. And
So you live in this country with somebody,
I live with my family.
and your
And,
family includes,
My mum, my dad, my brothers and sisters. So I've got 2 brothers and a
and
sister.
and you probably are residents of the UK.
Mhm.
How long for have you lived as a family here?
Uh,
Have you been born and brought up here?
I haven't. We moved here 2009.
Okay, okay. So you've been to schooling
Mhm.
here and you've grown up here,
Mhm.
obviously. So in terms of poisoning, how do you suspect that this poisoning occurred? And when it occurred, when did you realize it, and what made you have, or what was the effect of the poisoning?
So first, when I realized I was poisoned, I went to the GP, private hospitals. I started chasing up. I started keeping a record of all my everything, all the scans that I've done, and I've done plenty of scans from ultrasounds to MRIs to X-ray, ultrasound, CT, everything I can do. And like I said, there's been a massive cover up where even the GPs are only going by what they see on the screen and what the reports are.
Tell us. I mean,
Telling us,
obviously,
yeah.
what else can they go
But
by?
I've got to the bottom of how they have managed to fabricate these scans, where the systems itself are being compromised to for a massive cover up. Like I said, to cover up my poisoning, my true conditions, and everything. And yeah, I've got to the bottom of how they managed to get into the systems, and they can actually corrupt the files, where it's revealing.
Let's not go
What they
there,
want.
because that is
Well,
not.
we have to
my-
go there because that's
Tell
the
me
case.
what
isn't it?
your symptoms are at present.
So I've got pains
On your
in
right
internally
side.
no, both, and even my liver. So like I said, you have got my urine now. You can do bilirubin test. You can do all
We
sorts
can't
of
do
tests.
it. We won't do it here. We have tested your urine for blood in the urine, because this clinic is meant for suspected bladder cancers. So we are seeing you because of a GP request, which is okay. We don't need to worry. So the tests we need, we will do. You've had some blood tests done. You've got massive tests done in the private, and I've gone through most of these files. I'm not really convinced about. Yes, you had an MRI. The MRI says hemorrhagic cyst, as you say.
But only in one kidney. So
Yeah.
why the other one is in pain? Why
Well,
is
I
my
mean,
liver?
See, the pain can be
It doesn't
a
make sense.
lot
It
of
doesn't add
reason.
up.
No, I can understand that.
For me, because on your NHS records, if you see, they're trying to portray me as insane, and this guy has lost his mind. Or
On your
whatever.
NHS
But
records, I have a. What do you see on this page?
nothing at the moment. No.
So that's what I'm seeing.
Okay.
I'm nothing on you.
Fair enough. Yeah.
This is what I'm saying. I will start with scratch.
Mm-hmm.
I don't see a cancer patient there. I can tell you that.
you don't see a madman here as well. But
I can.
like I said,
I cannot say that.
you-
yeah.
for you- for you- for
could
you to
probably say the same for me for talking to you like this.
exactly.
So it's just a matter of how we approach it. I see a person who's come to the hospital who's got pain, which you say on both sides, pointing on the right side, agreed. The MRI scan suggests on one side only.
But like I said, both.
Yeah,
both
yeah, you
sides.
feel pain on
And-
both sides.
and the surrounding, especially my liver now as well, where the things have just gotten worse and worse. And like I said,
So
there's been a
let's do
massive
one thing
cover-up.
for starters.
It's,
We do one thing for starters. That you walked in here, that's fine. You're 26, and we've got nothing on you. You don't even have an ED attendance in emergency.
No, I've never been here before.
Well, that's good. So in terms of starting with scratch, let's get your blood test done. Your liver functions, your bone profile, your kidney functions, and your general full blood count. So that'll give us a note of where we start with the basics. Now you've got pain. Describe the pain. You say liver, you say both sides. Do you describe this pain as a pain that stays forever, or comes and goes, or makes you restless, or makes you want to stop doing everything?
It's enabling me to walk properly now, like
Okay.
a normal person, because things have just gone worse and worse. Because they have just kept me like this in my condition until everything rolls onto their side. It's a psychological trick. But like I said, I've been through hell.
But do you
and,
feel that the pain stops you from doing a kind of a brisk walk?
Mhm.
Will it?
Yeah, that's what
And when you have the pain, do you think you get restless?
yeah. It's like I said, I have to continuously put pressure at the back on both sides to keep up, because it just enables me to do anything, even when I'm sitting down, even when I'm laying down on bed, or anything.
Okay.
So it's a constant
What
pain.
gives you relief from the pain?
I get up, I take a walk, and then I, just put pressure on it, because
Okay.
like I said, it's in the back where kidneys are, and especially things have gotten worse where even my liver is like over here, is pain all around. And for me, I've done everything from my end to keep up with this.
Okay.
That means doing all sorts of scans, and the record I have, even if you show it to a radiologist or anyone, they'll be able to tell you that there's.
So your GP
things that
doesn't
are
give you any medicine for pain?
they prescribed omeprazole, and for some reason they detected, if you have a look at my record, they suggested all sorts of things, from H. pylori at the start, then there's something else, then there's something else, now there's a hemorrhage, and like I said, the whole story didn't add up.
Okay.
Even when you look at it from a bigger picture.
Okay. So in terms of what we are going to do, in terms of the bigger picture, 16th January is when your blood tests have been recorded on the system. We'll get them done today. You will have to go down before 5 o'clock.
So once you're doing the blood test, can you add everything so we are sure, like vitamins? For some reason they said there's
Listen, I have to do what I would need to. First, I would not. We would do the vitamins. If we do the vitamins, we'd look like fools. We need to first show a reason why we are doing vitamins.
No, I'm just letting it because they said
It
on my
won't
record.
allow
they-
me to.
Okay.
There are systems that we follow. So I've said we'll do liver functions, we'll do your kidney functions, we'll do your bone profile, we'll do your full blood count. Any faults in that, then we can justify putting in a request for, say, vitamin D, supposing. I can't do it without doing a bone profile.
No, it's the same
I'd
thing.
look like a foolish doctor, so don't make
No,
me
no,
look
I
foolish.
understand, because you're looking at my record for what you see on the screen, exactly like the GP.
Your
and they're not,
your
they're not
record from
understanding
the
me.
GP does not have any vitamins. And what blood tests there are, I can see them and you can see them because you get them through the patient knows best now. So whatever we are doing are tests which I would not really need to know, because most of these tests have been going backwards to last year.
Hmm. Like I said, I've done everything from my end to keep up with this, and it's
So
like
when
a
did this
big,
problem start?
bigger
When
evil.
did you start suspecting this?
It's been quite a while. So like I said, since I think end of 2023, I started keeping all the medical records and my history.
2023 you said.
End of 2023, I started doing all my test scans and everything, and I made a full massive record of it. And MRI has been done multiple times. I've done the CT, and yeah, all sorts of things.
Okay. So we are going to give you. Can you print out the requests? No.
And
We
you
give
have
you
to
this-
remember, all these tests are done digitally, meaning if
actually, I won't question
exactly,
anything.
they can be manipulated, they can be fabricated, because digital systems can be compromised, and they have been compromised before. So if you have access to do these offline, meaning manually, so you can do the blood test manually to know the kidney KFT,
I'm not
the
qualified to
LFT.
do that.
I mean, whoever's doing
There is
it.
no
if-
system to do that.
That's it.
There's no system in the world to do it. So, as in the NHS, I wouldn't say that because I deal with many patients. So, what we are requesting is electronically. How do they do it is in their own mechanized way. We cannot do biochemical tests anymore. I wouldn't know it. I'm not qualified to be a
No,
pathologist.
I completely
So
understand
I
that.
can't say.
Like I said, all my previous scans.
I'm a
have been fabricated
surgeon,
to
I'm a
cover it up.
urologist. I can
and-
go through your kidneys in terms of with the camera, but I wouldn't know how they do a pathology test. I'd rely on my colleagues who have been trained to do that. So we get you this blood test done. I will arrange a scan locally with my Newham team to corroborate the findings. And depending that, we'll escalate things. I still feel with your background that there is no risk of cancer. That's the intent of today's clinic. I've got a cancer clinic running. We all do tests related to that. I don't see that you're a candidate that fits the bill for that.
Oh,
And
so we wouldn't
from a
have-
bladder point of view, this clinic is for bladder cancers. Your kidneys, I understand. We'll review and visit this with the reports that we find here. And then we will talk. Okay, so at the moment I wouldn't say anything. I would request you hop onto the couch. I'll feel your tummy and your back, and that is all we'll do.
Sure.
And at least we'll have physically examined you. And if there is anything that I would think from a perspective of the kidneys, we'll see.
Like I said, I was explaining to you my circumstances and how I've been facing a very big deal.
Hop on here. Just take your jacket. Just pull down your trousers and lift your shirt. And undo your belt and pull it down. Socially, married, got a girlfriend? No? We'll slide it down a little bit. Don't worry, we only invade private parts. We're
fine.
both below the
You
belt.
guys are used to
I'll
it.
do that. Okay. Keep safe. That's okay. I won't touch that right now. Okay. How does the bowel work?
They're completely fine.
Okay. In terms of early morning erections, any problems with that?
Yeah, I do have some kind.
And
Like all of a sudden, feeling to urinate.
okay. Okay. Can you sit up for me? So no pain in here?
No, that's fine.
On that side more or on this side more?
It varies both sides.
Okay.
Depending how my posture is.
Well, that would be for everybody, especially for older men like me.
Like my circumstances.
But nothing that is tender here that I'm pressing. Okay, good. And just undo, just slide it down till there. Let me examine the genitals. You've been circumcised locally?
No, probably when I was a kid.
Okay. And that's the small cyst on the testes. That's one. So yeah, I mean, physically I don't find anything wrong. There's no lumps and bumps on the back that I see. So let's get your blood test done.
Mm-hmm.
I'll start with an ultrasound scan, and if need be, I don't know, but I don't think an MRI of the kidney is what I'll suddenly hop onto. If anything that is suggested on the ultrasound scan I'd rather put in a dye through one of the veins and take a picture of your kidneys and its structure.
Yeah,
That's what we will consider doing because they don't see that kind of a test. And I feel CT scans are a better way of delineating the roadmap and seeing the anatomy. And this, because you have so many tests, I also want a little bit time for assessing which organ to focus on, liver, spleen, or the kidneys. And our scan will give a bit better picture. Let's start with that and then we'll go.
Yeah.
Okay? So you will arrange this blood test now. You can go downstairs. That's the only thing. So as you go down, there's a coffee shop in zone 6. Through the double doors.
Floor.
Yeah. Through the double doors, they'll take the blood test.
Perfect. Thank you
And
very
for
much.
your scan, you're getting an appointment in the phone.
Oh,
It
Not
won't
today.
happen today.
okay.
But they'll do it.
Just a blood test today.
Yeah.
That's it.
Okay?
That's fine. Thank you very much. Hi there, you okay? I've been given this.
For blood test?
Yeah.
Need to book it on the machine behind you.
Over there. Thank you.
Luna's the star so far, but Becca, we need you to be the star in this round.
Fingers crossed.
Don't hesitate, don't pause. Sorry. Your time starts now. Animal. Classic novel.
Catcher in the Rye.
Reality TV star.
Sam Thompson.
Netball position.
Winter.
Family Guy character.
Stewie.
Fantastic work there.
Clean sweep. She must be a good little charm.
I mean, brilliant. Well, look, we know you got them all right. Let's see how fast you do it. Sarah.
Josh got 29.6. You got your clean sweep in 17.7 seconds. What a team. Well, for now, Luna's going to take a little break while you take your place in lane 1. Get it, Becca.
So, there we have it. Our first lineup. What do you make of it?
Spectacular. We have Grand Packers of Simon, Nicola, our VIP, the Chief's wife Liz, Mr. Romantic.
Yes, it's not allowing me to book it.
Speak to the people in the blood room.
Hi.
Hi, can I help
Yeah,
you?
I'm trying to book it on the system outside.
Blood test.
Yeah, it's not allowing me to.
Yeah, you might just have to go with the white. The white.
Alright, speak to him.
And your date of birth is 0810. 10, 2002.
Okay, that's all. We'll
Yeah,
sort it.
yeah, you say print out for urine as well.
Ah,
Yeah, for him as well. Yeah,
Give to
yeah,
him,
have to
yeah?
give to him. Yeah.
okay.
I've been given this little glass.
So you didn't see him? Oh, Reggie, poor.
How long does it take for the blood test?
Call you. No,
Result, sorry. How long does it take?
result
Yeah.
from tomorrow. What's your last name?
Rahman,
Rahman.
R-E-H-M-A.
Let's go inside there. Ask which number. And your date of birth is 17
01
01.
1999.
This will call you social.
Thank you.
You call in? So you check everyone in, yeah?
Yeah, you can roll it up. Do you have any letter for me or is it to do that?
I think it's a computer. We just
Right.
What is this blood test checking for? Do you know the list of all the things?
Yeah, check liver, calcium, kidney function, and fluid count. Today's
Okay.
date. So,
Got it.
is it the same one? The sticker you give me, the same test.
I've got this sticker. It's in my pocket.
Let me check it, the same test. Like you from upstairs, isn't it?
As long as it's done properly.
I think it was, yeah, it's nicer to like hurt.
Yeah, you can. This is for cold. It's like a cold first bite. Alright, so I'm gonna use this
Yeah,
one.
it was my first time having
Facial scratch.
So you always had without spray. So okay, I'm not going to spray.
Right.
Relax. Of course. Squeeze your hand. Yeah, for under 16 years. What do you do? You know what?
Perfect. Thank you very much. So good to leave, yeah?
Yes.
You know, was it nice and easy?
Yeah.